Hello, my name is Scott Spoonholtz, and I'm the Student Financial Aid Director here at the University of Kansas Medical Center. And I appreciate the opportunity to share some information with you about affording medical school and debt management here at KU Med. Some topics that we will cover today includes the costs associated with the program, the types of financial aid that are available to address those costs. We'll talk about whether special circumstances might apply to your situation and how to appeal those, and then some steps you can take between now and when you enter medical school to set yourself up for financial success. So starting with the costs. For the fall 25, spring 26 academic year, tuition for Kansas residents is a little over $42,000 per year. And for out-of-state students, it's almost $73,000 per year. Additionally, there are campus fees of about $850 for Kansas City or Salina students, and it's a little less expensive in Wichita. Wichita does not have a recreation center, so students are not charged for that. But students can find a membership to a gym like the YMCA if they want to be able to work out and those sorts of things. Additionally, we estimate about $1,200 for the first year for books and supplies. For living expenses, so we're talking about rent, utilities, car maintenance, gas, cell phone bills, kind of all of the expenses you need to live is $3,273 per month. And you would receive those for the months that you're in school. So in years 1 and 2, you're in school 10 months out of the year, so you get 3273 times 10 months. During each of the last 2 years, you're in school year-round, so you get 12 months of living expenses. We also include loan fees. Some of the federal loans, the government takes out what's called an origination fee of about 1 to 4%. So we add a little bit to the cost of attendance to try to make sure that when those fees are removed, that you're receiving the amount of aid that you need. And so in total, we're looking at about $77,800 for the first year for Kansas residents and about $108,000 for out-of-state students. And the out-of-state number may be a little different than what's on our website. And on the website, when we were creating the cost of attendance in February of 2025, we were anticipating that there would be a tuition increase for non-resident students. And so the cost of attendance was higher, but we ended up not raising tuition at all for non-residents. So it stayed at that 72,906. So I wanted to provide you with kind of the actual costs of the program. Each year throughout the program, the cost of attendance will differ depending on what your expenses are. So for the second year, the main difference is that you will start studying for step 1 and you will register for step 1. In the third year, again, you will start attending 12 months out of the year, so you need more living expenses. And then you will start studying for and register for step 2. And then during your last year, again, it's 12 months of living expenses, but you will start applying to residency locations. You may be traveling across the country to interview for residency locations, so you receive aid for that as well. So in total, based on 25-26 data, you're looking at about $328,000 for all the different expenses over 4 years for Kansas residents and about $450,000 for out-of-state students. So certainly that's a significant investment, and therefore wanted to just kind of compare that with other schools across the country. The most recent data that we can compare with peers is 23-24. And as you can see, our in-state tuition's a little less than the median for other public schools nationwide, and our non-residents comparable to, say, like a private school across the country. And that first year cost of attendance, again, is a little less for Kansas residents versus our peers, and fairly comparable with private schools for non-resident students. So certainly we don't anticipate that everyone has this amount of money saved, and so financial aid is available to help you pay for those expenses. And the first step is to fill out the FAFSA, the free application for federal student aid. They will take your income and assets, and if you are married, your spouse's income and assets, and try to assign what's called a student aid index. And let's say that number is $5,000. You subtract that student aid index from that cost of attendance. So roughly for Kansas resident, that was what, 77,000. So 77,000 cost of attendance minus 5,000 student aid index. That student has a positive financial need of $72,000. If that student aid index is 90,000, so 77,000 minus 90,000, that is a negative number, so that student does not have need, but they could still qualify for non-need-based types of loans. So regardless of your need, you'll still be able to receive financial aid. That student aid index just helps determine kind of the quality or attractiveness of the aid that's being offered to you. And as a MD student, you do not need to include parent information, so it's just based on the student and or spouse's information. So again, there's how that calculation works. Some things to keep in mind. So we are recording this on July 28th of 2025. This is a couple weeks after HR 1, the big beautiful bill, was passed. And there were a number of changes to federal financial aid in that bill. There is a fair amount of information that is known, but there is quite a bit that we are waiting for clarification on. So I will try to explain kind of what we do know, what some of these open questions are, and as things become more clear, we will update our materials and share that with folks so that you have the most up-to-date information. With financial aid, certainly, the best types of aid are ones that don't have to be repaid. So our School of Medicine has some scholarships. Admissions is on a rolling basis, and after you are admitted, you're given a 2-week window to apply for scholarships. You fill out one application, and then the School of Med will consider you for all the different types of scholarships that you qualify for. So filling out the FAFSA will help see if you can be considered for need-based scholarships. The School of Medicine also keeps a list of private scholarships that our students have used. Certainly you can do your own research, and that is fantastic as well. But they like to keep a list of ones that we know our students have received. So hopefully that encourages you to apply for those to know that somebody locally has received them. Our office manages federal work study. A couple of things to keep in mind on that. One, the School of Medicine does not recommend students work a job during their first semester. The pace of information that you learn in medical school might cover in 1 month what undergraduate covers over a semester. And we don't want you to put your academics at risk while you are learning how do I process all this information? How much time do I need to study? How much time do I need to spend on self-care? And then determine, do I have some free time that I could dedicate to working a job? But maybe in your second semester or beginning of your second year, if you want to find a job, you can go out on campus, look for different employers. And if it sounds like this could be a good match, reach out to our office. And at that point, we can check to see if you have financial need for work study. And essentially the government pays 75 cents of every dollar that you earn. So it makes employers more likely to want to hire you than somebody else who they pay 100% of the salary. It does count as a source of financial aid. So that would reduce potentially the amount of loans that you receive. So for instance, in-state students can receive 77,800 for that first year. If you got 3,000 in work study, then your loans would be 74,800. So that the combination of all the aid adds up to the cost of attendance. Something I would like to spend some time discussing is the Kansas Medical Student Loan. It's three different programs that the state has funded for a number of years. There's one program in primary care, a second one in psychiatry, and the newest one is for OB-GYN. With the primary care program, you do not have to indicate which of the four specialties you want to work in as long as one of those four works for you. Family med, internal med, pediatrics, or emergency med. There is a separate program for psych or child psych. And then OB-GYN just has that one specialty area. So digging a little deeper into the programs, what they share in common, they all pay your tuition. They also give you anywhere from $18,000 a year to as much as $22,000 per year for living expenses. They cover all of maybe 17,000 to maybe up to 24,000 per year because they don't cover the campus fee. The stipend has not been increased in, I think, at least a decade, if not longer. And so it's $1,200 less than what we are estimating students need. Doesn't pay for books, board exam related, or residency related expenses. And so you are allowed to borrow other loans, federal loans, institutional loans, private loans to fill in that $17,000 to $24,000 per year gap. With a KMSL program, you're allowed to match anywhere in the country that you want to, as long as it's the correct field. So if you have the primary care and you match in internal medicine in New York, fantastic. And you have psych and you match in Miami, perfect, etc. So you don't have to stay in Kansas during residency. You just need to match in the correct specialty. 9 months after residency, at that point, you need to come back to the state of Kansas and serve in the high need areas. Most activities that you undertake, you will receive 1 year of forgiveness for each year that you serve in the state. So if you received it for 4 years as a med student, you generally serve 4 years in Kansas, and then your loans are forgiven. The compliant areas are any counties except for Douglas, Johnson, Sedgwick, or Shawnee. So those are the Lawrence, Kansas City, Wichita, or Topeka areas. You can serve in any VA hospital. You can serve in community mental health centers. You can teach as a full-time faculty member in Kansas City or Salina. It's a year of service equals a year of forgiveness. Because the Wichita campus is in Sedgwick County, the statute says you have to do 2 years of full-time teaching in Wichita to forgive each KMSL contract. And then the last option is to serve at a clinic that exists for financially indigent patients. So an example is Grace Med has a Wichita and Topeka location, among others. Normally those would not be allowable because they're in Sedgwick and Shawnee counties. But because Grace Med exists to help low-income patients, you can do a year of service and receive a year of forgiveness. The way that we rate students to determine who receives the awards, we look at 3 different things: where you're born, where you graduate high school, and where you're living when you enter medical school. The highest points are awarded to students who are from the underserved areas of Kansas for each of those three areas. Middle of the road points are if you're from kind of the larger counties in Kansas, and then the lowest points are for out-of-state students. The programs have different amounts of funding. Primary care has been around since the 80s and 90s, and generally we can award anywhere from 100, sometimes as many as 120 students each year. The psych program allows up to 12 students per year, and OB-GYN up to 17 per year. We saved 30 spots in the primary care program for Kansas or for incoming students. And then some years we fill all 30 of those slots, and some years not all 30 of those slots are awarded. Additionally, throughout the year, some students may change their mind. They may have said, I want to be a psychiatrist, and then later learn that they want to be a surgeon. Or they wanted to live in Kansas after residency, but they meet someone from California and they know they're going to move out to California and practice there. And so we get contracts back. And at that point, we have a retroactive process. Students in any year can apply for the retroactive process, but if we have a failed contract, we want to try to make sure that those are being served. And so we give priority to fourth year students. Ideally, we would like to have 4 contracts for that fourth year student. So if we have enough of those contracts, we could help that student replace their fourth year financial aid. We could give them the value that they would have received as a first, second, and third year student, both with the tuition and the stipends, and then help them pay off as much of their federal or private loans with the value that they would have received in years 1, 2, and 3. So at that point, they're left with mainly forgivable Kansas medical student loans and minimizing what they have to pay back to a federal or private loan servicer. With the psych and the OB-GYN programs, we want to try to prioritize awarding at least some of those contracts to upper class students. The amount of money that we receive is such that we need to give multiple contracts at least to some of the students in order to try to spend all of the money. So with psych and OB-GYN, we do not save any contracts for incoming students, but we handle those all as a retroactive process and try to award those in September and October. But we have not generally spent out of psych or OB-GYN, so generally speaking, incoming students have been able to receive contracts in those programs as well. So that's kind of an overview, and certainly if the fields are what you're looking for, if serving in high need areas of Kansas is of interest, it's a fantastic program to, graduate with, less than half of the loan debt of other students. But this program is very punitive if you do not fulfill it through service. The interest rate on the loan is 15%. That goes back to the date that you received the loan. And essentially what that means, in under 5 years, the amount that you borrow doubles. So this is not something to be taken lightly. It's certainly not fun for anybody involved when you go out of compliance and find out, maybe you owe $200,000, $300,000. So certainly we encourage people, if you're interested, apply for both KMSL and a scholarship as an incoming student. If you are offered both, you have to choose. Do I want to take the scholarship and not take KMSL? Or do I want to accept KMSL and say no to the scholarship? You can't have both. The School of Med wants to try to spread out their scholarships as much as they can. So if you're receiving KMSL, National Health Service Corps, military those types of scholarships that pay tuition and living expenses, you're not eligible for School of Med scholarships. Speaking of those other service programs, the military, the National Health Service Corps, Indian Health Service Corps, all of those will pay your tuition. They'll give you living expenses. Generally, they require a 2-year minimum service, but if you receive the programs for 2 or more years, it's a 1 year of service equals 1 year of forgiveness. Let's talk a little bit about different types of loans, both with the federal government and private sources. On the federal side, there's unsubsidized and primary care loans. And then part of the Big Beautiful Bill, they eliminated Grad Plus for students who are beginning programs in July 1st of 26 or beyond. On the private side, the fundraising part of KU Endowment has a fund, a loan fund, and there are other types of private loans as well. So on the unsubsidized loan side, the Big Beautiful Bill increased the annual limit on unsubsidized loans. They used to be 42 to 47,000 a year. That is increasing to 50,000 a year. And then the lifetime limit is 200,000, but it's unclear, is that only 200,000 that you borrow during medical school, or if you did not borrow as an undergrad student, there would have been 31,000 as a dependent that you could have borrowed. Could you add that to the 200,000 and borrow 231,000 between undergrad and med school? That part, we're looking for some clarification on that. The interest rate for 25-26 is just under 8%. That rate will be set in May of 26. So we'll know what the fixed rate is for your first year. And then each year there may be a different fixed rate. So your second year, there may be a second fixed rate, third year, a different rate, fourth year, a different rate as well. But they are fixed based on when you borrow them. And then the government takes out that origination fee. It's $10 for every 1,000 that you borrow. So they would send us 990 of that 1,000 that you borrowed. If you are borrowing for the first time, there's loan entrance counseling for graduate professional students, and there's a master promissory note, and you need to do both of those before the loans will disperse. Again, the Grad Plus program, unfortunately, is eliminated when you are starting a new program in July of 26. So in the past, students used to borrow this to fill in gaps between the cost of attendance minus other aid, but this is no longer an option for new students. Therefore, some other options to get more than the 50,000. One is through KU Endowment. It's 6,000 a year and 24,000 over your KU career. It's not a huge program, but that interest rate is lower than federal loans right now, and the origination fees just slightly higher. Interest is accruing on this while you're in school, but you don't have to pay during residency. If you don't want to, you can wait till a year after residency. Because you are independent on the FAFSA, you do not need a co-signer on this program. The last option would be private loans. And so these are based on your credit score. So whether you are approved, it's based on credit. The interest rate that you receive is based on credit. So it is possible that you may need a co-signer to either qualify or to get a rate that maybe you're looking for. The good news with private loans is you can borrow up to the gap between the cost of attendance minus the other aid that you have. So private loans can sometimes fill in $20,000 gaps or higher amounts than that. We do ask that you fill out an alternative loan request form, And part of the reason for that, depending on how much you're asking for, if we can see that you qualify for a better rate through unsubsidized loans or endowment loans, we like to notify you of that to try to help you save as much in interest as possible. So to illustrate for a resident for that first year, to pay for the cost of attendance, let's say that student needs the full 77,800. So the School of Med gives the student 4,000 in a scholarship. The Department of Ed will award up to 50,000 for the unsubsidized loan. So there is a $23,800 gap. You could borrow 6,000 of that through KU endowment and the other 17,800 through a private loan, or do all of it through a private loan. That's kind of how the puzzle is put together. For non-residents, everything in the cost of attendance is the same except for the tuition. And so kind of using a similar example where the student gets 4,000 in a scholarship, 50,000 from the FAFSA, they have a $54,000 gap. Again, endowment could help with 6,000 of that, but you might need another 48,000 from a private loan to get up to that full cost of attendance. And just to kind of put things in perspective, certainly our students have done an excellent job over the years of borrowing what they need. The average loan debt has varied from kind of the low 170,000s to kind of the mid 190,000s. And that's lower than the national average for borrowers at public schools nationwide. So certainly, debt is something to watch for, but it is manageable with the kind of salary that you have. And we're certainly happy to kind of work with you to kind of talk through different loan repayment scenarios to be able to find payments that match kind of how you want to attack the debt versus other financial decisions that you want to be making as a resident or as an attending physician. But debt in med school is not the only debt that students may finish with. Close to a third of students borrow as undergrads nationwide. Some students graduate with debt from credit cards. Maybe they borrow private residency and relocation loans. So there's some other money that students may need to factor in during, again, residency or attending years. But there may be some of you out there that are looking at the cost of attendance and saying, you know what, that's not quite enough for what I need. And there are special circumstances that allow us to award more. So we have appeals in the following areas. So one is to buy technology. Check out our website to see when those deadlines are. You need to buy your laptop, your tablet, your desktop, whatever, kind of closer to the start of the program. So don't buy it, 6 months ahead of med school, but I think closer to maybe a month or 45 days out, you could purchase your technology. And then you could borrow extra loans to reimburse yourself for what you spent. With dependent care, we do surveys each year on what the costs are for different ages. And so if the limit for infants was $300 a week or something like that, if you're only spending $250, that's below the limit. So you could get additional loans for the $250 a week that you're spending. If you are paying $400 a week, that would exceed kind of what our limit was. And so you would get reimbursed up to $300 based on that age. The other two areas that are most common are vehicle repairs and medical dental vision. There is money in that 3273 per month in living expenses for gas and car maintenance. And so you would need to exceed what that amount is in order to increase the cost of attendance. So if it was, say, $800 a year, if you had a $2,000 car repair, you could get the difference between the 2,000 that you spent minus the 800 that was in the cost of attendance. You could get an extra $1,200 reimbursed to you in a loan. Same sort of thing with medical expenses. Let's say it's, I think, in the ballpark of $800 a year for medical expenses. If you exceed that, you could get extra money for the amount that exceeds the cost of attendance. Students often ask about income appeals. So some of you may have had a gap year or some gap years and you're out working and you're coming back to school and you're going to be full-time students. And certainly that is a financial hit on what you're doing right now. But all of the aid that I've been describing is not based on financial need. So whether somebody made $100,000, whether somebody made $0, you're still getting the same unsubsidized loans, endowment loans, private loans. We cannot replace the income that you had before. You would need to live within the cost of attendance, the 77,800 or 108,000 for out-of-state students. And so the only thing an income appeal could help with would be something like a need-based scholarship. But in some cases, you already have lots of financial needs. So if the student aid index said you had $1,000 as the student aid index, to go from $1,000 to zero is not a huge difference for the financial need of a scholarship. And so we would tell you, don't worry about doing an appeal. You're still going to look very needy as having $1,000 student aid index as a zero student aid index. Lastly, I want to talk a little bit about what things you can do between now and starting the program in July of 26. Some things that I've had conversations with students and have been kind of struggles for them I want to pass on to you. So one of those is if you have credit card debt, that is not something that I can increase the cost of attendance to help with. And I've had some students who owe $400 a month. And so that's eating out of your $32.73 for living expenses and forcing you to live off of $28.73 a month. So that might be more difficult. So if you have credit card debt, if you have the opportunity now to work extra, to sell some things that you don't need, just anything you can do to help reduce or eliminate that credit card debt will keep you from having that being a stressful thing hanging over your head through medical school. The same thing is similar with car loans. I cannot give you extra money to reimburse you for a car loan. I can help with car repairs. So even if in situations I've had people who have said, my car is 20 years old, it just had this expensive engine problem and it's going to cost $8,000 to replace the engine. But I could go out and get a used car for $6,000. Can I get some extra money to get the used car? I am not allowed to give money, even though that would be less expensive. So if you have a car payment, again, that you're having to use your living expenses and you're having to live off of less. And so if there's any way to pay that off or to get into a vehicle that is paid off would be financially a good thing for you during medical school. If you have not done budgets before, now is a great time to just start working on that. It takes 3 months, 6 months, sometimes a year to really get good at budgeting. It's easy to think of regular expenses, rent, maybe food is regular, things like that, but it's harder to always remember the irregular expenses, your car tags, car insurance, maybe birthdays or other things that you spend money on. And so the longer you spend on your budget, the more you uncover those things and you learn, in order to pay my car tags, I need to set aside X number of dollars each month so that when it comes due, the money is there to pay for it. Certainly, me and my staff are happy to speak with you to help you feel comfortable about what your options are. We're open 8:30 to 4:30 Monday through Friday. There are five of us, and we're all based in Kansas City. We have colleagues in Wichita and Salina who have been trained on some common questions. So if you're attending those campuses, certainly they can help and determine, oh, you're missing a promissory note. That's why your loan hasn't paid. But if they don't know the answer, they refer you to us, and we're happy to speak with you on Teams or Zoom or a phone call or email. But certainly, in October, November, December, things slow down a little bit for us. So if you want to spend 30 minutes or an hour talking with us, by all means, that's a perfect time to reach out or reach out any other time. And we are excited that you are looking at KU and hope to see you come fall of 26.